N. Anuradha. She graduated Master of Science in Yoga. Research scholar. Registered international yoga teacher from Yoga Alliance, USA. Qualified yoga teacher from YCB under Ministry of Ayush. Trainer of Garbhar Deepika. And she also doing international yoga therapy course from Manushi Institute of Yoga. Affiliated with IAYT. Teaching experience in yoga 8 years.
M. Anuradha, Health Warriors of Yoga Therapy. We are proud of your yogic services.
Without noticing it or without paying attention to it. Hypertension means it's high blood pressure. It's a condition in which the blood flows towards the artery is too extreme. As we talk of blood pressure, systolic and diastolic we'll talk about. Systolic refers to the blood pressure in the vessels at the heart as the heart beats, whereas diastolic refers to the pressure between the beats. As the heart beats, the gap between each beat, it is measured. So for normal adults, it will be 120 by 80. So if it goes above 120 and the systolic, if it goes above 120 and the diastolic, if it goes below 80, it is considered as high BP or high blood pressure. So it is a very critical medical condition because many of us are not caring about it. It is left unattended. So it increases the risk of cardiovascular, that is the heart and the blood vessels related disorders. Psychologically, they are, because most of the stress is one of the major cause for hypertension, and it affects the kidneys and other diseases. It is a gateway to many other diseases. Around 1.28 billion adults are with hypertension, and it is of the age between 30 and 79. What is the reason for getting hypertension? There are many reasons. One of the reasons is stress. But still, through the diet also stress can be, that is hypertension can be attained. It's like having a diet high in saturated fat, trans fat, lack of fruits and vegetables in their diet, excessive salt consumption, use of alcohol and tobacco, and even lack of physical exercise, overweight, and the major cause stress. So many people are with hypertension. So it is one of the reasons for the higher mortality level. 1/4 in adults are with hypertension in India, and around it's 29.8%. It is due to the sedentary lifestyle and various reason factors. So earlier we have many research evidences prove that these pranayama are helpful. Why? There are many different pranayamas are there, but all pranayamas are not good for it. We can't take it as a common thing like all pranayama is good for hypertension. There are particular pranayamas which is very good for hypertension, like Brahmari pranayama and Nadi Shodhana or alternative nostril breathing. So in these two pranayamas bring about an effect on the autonomic balance, which is good for the sympathetic. It will reduce the sympathetic activity and increases the parasympathetic activity. So slow-paced Brahmari pranayama for 5 minutes induced parasympathetic dominance in the cardiovascular system. And the alternative nostril breathing gives stability to the autonomic nervous system, because as we breathe through left nostril and it activates the parasympathetic, and through the right nostril it activates the sympathetic activity. But as we go in the alternative nostril breathing, it brings a balance between these two things. And it decreases once the parasympathetic nerve activity increases. It will reduce or decrease the heart rate breathing rate, decreases blood pressure by increasing the cardiovascular efficiency. Thereby, it will eliminate, elevates means it raises up, gives a good mood, decreases anxiety and depression. Nadi Shodhana Pranayama and Brahmari modulate the sympathetic and parasympathetic, thereby improving the autonomic functions of body, resulting the mind, when the autonomic function is improved, the mind becomes relaxed and the efficiency of the subject is improved. So there are references to various researches done by various researchers. Scientific studies. A study was made by Ranjana Ganpat Triambake. She's an assistant professor in BVDU College of Nursing, Pune in India. They measured the blood pressure and pulsation, that is pulse. It has reduced significantly, and the symptoms from severe to normal, it has been the symptoms of high blood pressure like dizziness, headache, shortness of breath, everything was under control. And they used pranayama as the variable, and it was given to the subjects daily, even morning and evening for 30 minutes for 10 days. So they recorded the test before post test and the completion of the training. So it showed a high difference in the systolic, that is from 154 millimeter mercury to, it was reduced to 133.2 millimeter mercury, and the diastolic from 93.8 to 82.26. The same way a study was made by Adeline Sinija, where 60 subjects were taken for consideration who met all the standards which were allotted, and they were divided as two groups, 30 as experimental and 30 as control group. The intervention was given, that is the pranayama practice was given for the experimental group. So pre and post test was conducted, and they were assessed. The study concluded that this study, they did Brahmari as the intervention. So they told it was very effective in maintaining blood pressure among adult people. The same way, male yoga practitioners were taken from Dev Sanskriti Vishwavidyalaya Haridwar by Manoranjan Tripathi. They consented to practice Nadi Shodhana for their study. So before and after practice of Nadi Shodhana, the physiological variables like the blood pressure, heart rate, and blood glucose was measured. So the test administered before and after Nadi Shodhana practice, they did it in the fasting. It gave a significant difference in the both systolic and diastolic. So they have given a conclusion that Nadi Shodhana pranayama is very effective for decreasing or lowering the high blood pressure. And to evaluate the effect of relaxation. So when a person is stressed or when a person with high blood pressure, their mind will be, the waves, brain waves will keep on moving, their thought will be faster. To that, they have to calm down the mind. That is more effective through pranayama only. And they were given practice, they were divided into the same way, they were divided into two groups. One was given anti-hypertensive drugs. Only the drugs was given for 6 weeks, and the other group, they used drugs. Along with that, they practiced pranayama also. So the person who used, the group which used pranayama along with the medication, because we can't stop medication when a person is taking medication. Along with that, they were given practice, and it showed a tremendous change in them. So it enhances the function of parasympathetic nervous system, and they got the being stressed, they were now in a state of relaxed, and pranayama can be useful as an addition to the anti-hypertensive drugs, and it gives a better control among the mild hypertensives. The main goal of this study is to support and empower individuals to manage their own health by following principles of yoga. By following the principles, a person can develop his own health. He can monitor his health. Like using yoga asanas, pranayama, meditation, and guided imagery to elevate psychological and psychological and physical well-being. That is very important. The complete focus of yoga therapy is to incorporate, is to unite the mind, body, and the spirit. Pranayama has the capability to repair, regenerate, and recuperate the body. Conscious breathing lowers blood pressure and also the amount of hormone, stress hormone like cortisol that is present in the body. By conscious breathing only, we have to control all these things. Pranayama has shown to influence the cardiovascular system by slowing down the heartbeat and the blood pressure. So the training of pranayama is designed to educate adults to use in the daily regime for their self-care and to it acts as a tool to lower the blood pressure, prevent the occurrences of the complications related to the hypertension. It can be done only through Brahmari and Anulom breathing techniques, that is through pranayama, slow pace pranayama. So reasons for implementing. Why yoga means we can use any type of yoga, anything, but we can't take it in such way because these are for particular disease, a particular pranayama will be helpful. For hypertension, Bhastrika or Kapalbhati cannot be given. So for that, therapeutic yoga is required. So though there are several breathing techniques, only a particular technique can be followed to lower the blood pressure, to retain the health. So there are various reasons for implementing yoga as a therapy. It will improve the oxygen level, thereby it removes or reduces toxins in the body. And Brahmari and Narishodhana are the therapeutic tools. They are the tools, interventions to lower blood pressure, which is the main cause for hypertension, and there are various reasons, but one main reason is the stress. Focused concentration and slow deep abdominal breathing with extended exhalation. That is very important. Extended exhalation. Normal breathing with focused breathing differs. We have to focus, concentrate on the exhalation, a deep inhalation with a extended exhalation. It calms and reduces the hyperactive sympathetic activity, thereby activating the parasympathetic. So Nadi Shuddhi, it has been mentioned in many ancient philosophies like Yoga Upanishads, Granda Samhita, Hatha Yoga Pratipika, that Brahmari Pranayama is a practice for spiritual. It's a spiritual practice, which means it requires peace, calm, and clarity. And it is a tool to reduce stress and to calm down the mind. Nadi Shodhana improves the vital capacity and controls the heart rate and the blood pressure, and it enhances both physical and psychological health status and wellness.
Good afternoon, madam. 3 minutes more, little fast.
Yeah. Evaluation. So yoga therapy begins with the evaluation. First, we have to find out what diagnose them, whether they are following any medical treatments, and through questionnaires we can assess them, how frequently they're getting headaches, dizziness, short breath, how their breath is, and the neck and the chest area. They may get pain in the neck and the chest if they are stressed. So if the pressure is, the blood pressure will be normal if it is 120/80. And if the pressure raises above 120 and it goes 80, it is below 80, it is considered as a high blood pressure. So stress increases the body's production of hormones such as adrenaline and cortisol, and also more blood, as the blood, your heart pumps more, it narrows your arteries and higher the risk. So Brahmari and Nadi Shodhana produces relaxed state, and this state parasympathetic will be dominant and sympathetic activity will be reduced. So it has better control for the hypertension, And the vibration made through Brahmari, the sound, the humming bee sound which we make in Brahmari, it will increase the conduction of the vestibulocochlear nerves. So alternative nostril breathing, it brings a balance between the cerebral hemispheres, balances the energy and brings the feeling of calmness and freshness. Method. First, the client has to sit in a very relaxed state in any relaxed and meditative posture. Then this session, straight away we can't go for Brahmari. First, we have to start with abdominal breathing, slow and a deep inhalation and focus on the movement of the abdomen. Then Brahmari has to be practiced with their thumbs onto external auditories, just closing their thumbs. Thumb touching the tongue should touch the upper palate or push the upper palate, eyes closed, and mentally they have to visualize at Agna Chakra in between your eyebrows. And while they inhale, they are instructed, while they are exhaling, they are instructed to make the humming bee sound till they fully get exhausted. So this sound will make the vibration on the laryngeal walls and the inner walls of the nostril. So pranayama and Brahmari has to be practiced for minimum 5 minutes in the beginning, and later it can be extended to 10 minutes. And the same way Nadi Shodhana, it is, we have to inhale through the left nostril and exhale through the right, and inhale through the right and exhale through the left. So these with the counts like 4 inhalation, and while exhaling 8 counts we can exhale. But later on, as they keep practicing, they can go for retention. After inhalation, they can go for retention. And after exhalation also, they can go for retention. Themes governing the therapeutic. So when the sympathetic nerve system is higher, it is connected to the desensitization of the arterial and cardio baroreceptors. As a doctor said, the baroreceptors will be desensitized, which is the main cause for increasing the resting blood pressure. Sorry. And this phase, slow pace pranayama like Brahmari and Nadi Shodhana will reduce the sympathetic and it will increase the parasympathetic. And the aim is to relax the mind, the body all the way through cardiovascular system. The role of breathing is to supply good amount of fresh oxygen for the metabolism of the cells and to reduce carbon dioxide. So the person who practices Nadi Shodhana tries to breathe, but also breathing is not important, but breathing with concentration is very important, which leads to attentiveness. So the diaphragm present in the thoracic region and the muscles in the neck are relaxed and further relaxing the muscles of the face. So this type of attentiveness will remove all the worldly thoughts, fears, and de-stress them. So mind becomes very calm. The function of parasympathetic will get activated, controls the heartbeat and the systolic blood pressure. So we are come to the conclusion that hypertension is one of the treatable diseases in the world. But when we are giving the client the therapeutic tool, we should not ask them to stop the medicine. Along with the medicine, the anti-hyperactive medicine, we have to do the practice, and the autonomic nervous system supervises this. Once it gets activated, it will supervise the pulse rate and the blood pressure linked with the cardiovascular system. So Nadi Shodhana and Brahmari encourage the activation of sympathetic. It will reduce the sympathetic activity and activates parasympathetic and encourages refreshment and blissfulness, and even sometimes it will lead the subjects to even a meditative state. So this is one of the best practice, like alternative nostril breathing and Brahmari will be the best practice to manage the normal pressure and to be stress-free in our life. Thank you. Thanks for giving me this wonderful opportunity. Thank you, ma'am. Thank you, sir.